back of this news about schools, there's limited data from South Africa on exactly how susceptible children are to COVID-19. However, it appears from countries who've had to deal with the pandemic longer that children have a lower risk. In the 1 to 9 age group, 3 children have died, while there were 7 reported deaths in the 10 to 19 age group. Professor Haroon Saloojee is the executive member of the South African Paediatric Association. He joins me now. Prof, good evening. It's a pleasure to have you with us this evening. Firstly, what are some of the patterns that you're seeing, especially around our younger population when it comes to COVID-19?
So we've discovered 3 things. One is we've found that children are less susceptible to the virus, and that's been shown that in terms of testing, much fewer of the children have tested positive. So we have about a third of the population in the country, about 20 million children. But if you look at all the tests done, only 6% of tests have been in children. So that's the first thing. We know children are less susceptible. The other thing the report from the National Institute of Communicable Disease has shown us is that, in fact, when children get the infection, they get much milder infection. So, again, the report suggests that very few children have been hospitalized, and if they are hospitalized, they generally don't end up in ICU. And we know that probably about 80% of children have mild or no symptoms of COVID. So that's also good news. And you mentioned the issue of deaths. The NICD report has 3 deaths. This was until the 7th of June. And all 3 were children who had serious other conditions. One had a child with a leukemia, which is a blood cancer. The other had a very serious heart problem. And the other child had multiple myeloma. So these weren't ordinary children. These were children with severe morbidity. The last issue of interest is about transmission, and that's been the big debate. Do children transmit in the same way as others? And again, we don't have any South African data on that, but what we do know is that children are much less likely to transmit the virus than adults, and that's particularly pertinent in the setting of schools, where while it's known that children could transmit to others, what is known from international experience is that very few children transmit to adults. And so I think that's a pertinent consideration.
Sure. And it's of course been a big concern because many parents thinking about sending their children back to school worry about whether or not, even if their children are asymptomatic, they could potentially bring the disease back home. And we've heard education officials warning against, letting young ones who are back at school then interact with some of their grandparents or even elder members of the family who may already have underlying comorbidities. So are you saying that risk, even when a child is COVID-19 positive, is not that high?
Yeah, so the first point is we know children do transmit the virus. But we don't have South African data, but the international data suggests that of the whole transmission of COVID in the community, 2 to 4% may be the result of schools opening. So there's a lot of concern that schools are those hotspots of viral transmission. Only about 4% of all transmission. In other words, 96% of other people who are getting virus are getting it at home, in the community, in malls. And so there's a real fear that schools are the hotbed, but they ain't. And as I said, it's not South African data. But we also have evidence from other parts of the world, like Scandinavia, Denmark, Finland. Many European countries have opened their schools. And we haven't seen these massive outbreaks. We had the case last week in the Eastern Cape, but clearly the evidence there suggests that there was the breakdown in the fundamental infectious disease control measures, the PPE as we talk about it. So the international experience clearly says that schools are not the hotbed of virus spread. And I think that's critical to understand.
Sure. How soon, Professor Haroon, will we be able to get data that's specific to South Africa? Because I imagine that too would be important.
I don't think that's going to come very soon, because what that requires is to look at transmission patterns. How did people get an infection from the others? And obviously that requires lots of testing. And at the moment we have very few tests. We are consumed with testing at least patients in hospitals and healthcare workers. And so that kind of studies are not that easily done. There's only a handful of those studies internationally. So I'm afraid we're not going to get that answer very quickly.